Ready? Doctor, did you attempt to stop the bleeding? Yes, I did. And what was the result? The bleeding, which can be copious, is stopped by applying pressure with a sponge, which may be dipped in epinephrine to constrict blood vessels. Doctor, the thrombin powder was used by you, was it? Yes, thrombin powder, which promotes clotting. Other methods include tying off bleeding vessels or sealing them with heat diathermy. Doctor, once the tonsil on one side is removed and the bleeding is controlled, the surgeon does what? The surgeon repeats the procedure on the opposite tonsil. Let me ask you about this, doctor. If performing adenodectomy, the surgeon uses a mirror to visualize the adenoids, which are hidden behind the nasal cavity. Adenoidectomy is then performed, is that it? Well, you got it. Using specialized steel instruments with long handles, an adenoid curette has a sharp cutting edge, and advanced punch has a chamber that is placed over the adenoid tissue. Doctor, when closed, does a blade cut on the tissue? Yes, it does, when it falls into the chamber for removal. And the adenoid forceps are used to do what? To remove the residual tissue. Is that a host or hot suction device that can also be used to cut and seal adenoid tissue? That is correct. And is it electrocautery? Is that what it is called? Yes, it is electrocautery. While simultaneously sucking away removed tissues, is that right? Well, it is an alternative approach to remove the adenoids by operating through the nasal cavity with a suction debrider. Doctor, bleeding of the adenoid bed is controlled by nasal packing and heat sealing or electrocautery. Is that correct? I think I said that before. If bleeding is persistent or recurs, a postnasal pack may be left in place for 4 to 24 hours after surgery. Is that correct? Well, if significant bleeding occurs during surgery, the stomach may be emptied with a nasogastric tube to reduce the possibility of postoperative nausea and vomiting. Doctor, let me ask you about intracapsular tonsillectomy. Yes, intracapsular tonsillectomy does not remove the whole tonsil, does it? No, but 90% to 95% of the tissues are removed, leaving the thin outer layer or capsule of the tonsil in place so the underlying throat muscles are not exposed. Doctor, does this achieve using an electrically powered endoscopic instrument? Yes. Such an instrument is called a microdebrider, which rotates to shave tonsil tissue away. Does the shaving or the shavings which are removed using a continuous suction device, does the remaining tonsillar capsule act as a biological dressing to reduce inflammation and infection? Yes, the intracapsular tonsillectomy is less likely to cause bleeding after surgery. And doctor, discomfort, is that right? Well, discomfort, yes, is also reduced. In some cases, the remaining tonsillar tissue reviews or regrows so that further surgery is needed for persistent tonsillitis in the future. But this appears to occur in less than 1 in 100 cases. Doctor, let me ask you this. I don't think you mentioned it before. I am not saying you did that deliberately, but you did not mention it. What are the benefits? Removal of enlarged tonsils and or adenoids can improve or solve related problems such as recurrent throat infections, middle ear infections, otitis media, plus glue ear, nasal voice, snoring, or sleep apnea. Okay. Gotta get going. You know, let's see what happened with that stock. The last I looked, it was 1 penny short. If it didn't